Welcome to your Swiss Health Television. It's wonderful to have you watching. In this conversation, we will be discussing a revolutionary manual three-dimensional treatment technique that focuses on the bone's osteomodulation, or perhaps easier to remember, the so-called Schneider technique. And especially in the field of healing traumatic brain injuries, there is nothing comparable. Welcome to our Swiss television studio, dear Gerhard Schneider. I'm delighted that you are here. You are a trained physiotherapist. You are a holistic therapist, and above all, you are a healer of the new era. You have developed the osteomodulation, so to speak. You told me that it came to you. Let's unravel that together. What kind of treatment technique is this? And how did it emerge in your life?
Hello, Britta. It's wonderful to be here. Thank you for the invitation. And yes, it was interesting. It simply came to me. It developed step by step until at some point in the early 2000s, I suddenly realized this is something special. This is different from everything else. I suddenly noticed that it is always three-dimensional. You have two lectures. I was partly working with it, but I didn't realize it. Because you just do things and see what solutions you find without always precisely tracking what you're doing. It works, you know it works. But that it was actually something of my own, I only realized that later.
When you say three-dimensional, how should I understand that?
In most manual techniques, you simply go somewhere into the depth and apply pressure and displacement. Or you have rather superficial kneading treatments, but they don't go as deep and above all not into this solution. It's about the solution. And how we get there is by not going so deep, but rather into the layer where the adhesion is. I also have to say that's where seeing with your hands comes in. That means I feel what I'm doing, not just that I know what I'm doing. So then I know what I'm doing, but I have to feel it. And that's absolutely essential. And then intuitively I can go precisely into the layer where the adhesion is. And then I call it harvesting the adhesion. And it happens at a speed that's almost unimaginable. That's when the adhesion releases, releasing adhesions, dissolving hardenings, resolving scars. It's incredibly fast. People almost always get dizzy at some point because the meridian system suddenly starts spinning so rapidly that it can't balance itself out that quickly. It only takes a few minutes and then everything is fine again. It simply needs a little time to catch up. That's one aspect. It's the Schneider method, not the Schneider technique. The Schneider method, but the foundation was actually the modulation technique. And from that, the osteomodulation emerged because I always had the feeling that more needed to be done at the bone. That's what's missing. And with this three-dimensionality, two-dimensional, I could never achieve that. Impossible. I tried it, but it doesn't work. But with the three-dimensional technique, where I also incorporate rotation and the shifts precisely in the right direction, there you need an incredible amount of sensitivity. And you can achieve that, you can learn it. And then I can address bone hardenings, bone blockages, bone holes or cracks. I can, to some extent, work on them, seal them up, as I often call it, almost like forging. And that's how it developed, that I actually started with the head, the jaw joint. And then I realized that, in fact, an astonishing number of people have had head injuries at some point, major or minor ones. The really serious ones are well known, severe skull injuries or surgeries. But there are also much smaller ones. There are also those that don't create any holes, that aren't visible on the surface, in other words, the hidden ones. And even those can have a significant impact. Everyone knows the situation. You fall on the back of your head. Many people then experience dizziness. And that can be resolved very quickly. Many people also develop coordination problems. That too can be resolved excellently. Because often it's simply a trauma to the bone. It doesn't necessarily mean that the bone is actually injured. The sutures become traumatized. You can see these connecting sutures. They are traumatized. Of course, there is often a shock involved as well. I also address shock resolution, both at the cellular and emotional level, which is absolutely essential. And I have discovered a way to make this process incredibly fast and truly sustainable, completely different from what is usually known. And that is absolutely essential. And as we know, brainwaves are measured. That's something people are familiar with. And whether a brainwave flows well or not is also connected to the cranial bones. When people hear about cranial trauma and the like, the focus is always just on brain injuries. But since the bone is also a reflex organ, if the bone is hardened, then underneath it, the brain current, so to speak, its flow is simply reduced. And I notice this time and again when I work on the bone, and you really can, whether it's a small area that is hardened, whether it's large areas that are hardened, or even if the entire skull is blocked as a whole. And of course the sutures as well, but also I almost have the feeling, because often there's a little pop when I go through there. I can feel it. I can do this very precisely to 1/10 of a millimeter, so nothing happens. Even though it might look wild, it's actually incredibly gentle. People say that it's usually also very pleasant. I even believe that you can reach the sphenoid bone there, that the adhesions of the sphenoid bone are released, because it really makes across the head almost like a little rumble. And then people say, that's pleasant. Now my head feels so free. Exactly. Or if there are incisions, I've had incisions. I have to tell another example, a funny one. Crazy, but still funny. Because when people are that crazy, it almost feels like a cabaret show. So I had someone who had a 6 to 7 centimeter tear in his head and up to 3 to 4 millimeters wide. But I have to tell the story. Every 3 years he had a huge accident. He had some kind of recurring pattern.
Car accident?
Doesn't matter. Car accident, something bigger. Every 3 years, truly in rhythm. And then he goes up into the mountains on a dirt path, a hiking trail, and tries to ride his bike hands-free. I mean, what could possibly go wrong? He crashed headfirst into the ground, and I think he was stuck in the dirt. Actually, it's a tragic story, but it's just crazy somehow. And then he had 7 fractures in his head, that huge hole there. Then he broke his cheekbone, I think, 3 times. Upper jaw fracture, I don't know, so many things were broken. And he also came in looking like a zombie. A friend of ours sent a mutual friend. He has to go to Schneider or to Sharazak, as we say in Salzburg. And then he really came in like a zombie. I asked him, how are you? He says he was really that traumatized. And you know that when the shock is very great, that people are almost like they're frozen. I didn't talk to him for long because I realized it didn't make any sense. I did the shock release with him. It really didn't make any sense because I couldn't really talk to him. Then we released the shock. Then he told me the story. Then he was a little bit present again. Actually, he was immediately present again. And I always release the cellular shock as well, because the cell is also a living being and is traumatized along with the person. And then he told me about it and everything that happened. And the funny thing was that whenever he has to eat or when he coughs, it whistles through his whole head. And when I hear something like that, I just have to laugh. That was connected to his craziness and that whole thing. But
Crazy.
yes, he was completely crazy. Also crazy in his head. That
Fits?
That fits. I then blended the cells together. I kneaded them together. You can do that because a bone that is broken, it's similar to skin. It dries out. It can no longer connect well. With skin, you also make an incision again so that it can grow back together. And with bone, I don't think there's much you can do in that direction. Wherever possible, you apply pressure so that it fuses together under pressure with a cast and so on, but that's not possible there. And then I really worked it back together for him. And after 5 or 6 sessions, I always did half-hour sessions back then. After 5 or 6 treatments, he suddenly said, now the whistling is gone. It stopped. The whistling is gone. And he was able to bite again as well. Exactly, the eye socket was also fractured. And with 10 half-hour sessions, we managed to get it sorted out wonderfully. He then took a break for 2 or 3 months, and after that, he played football again. I knew him from playing football.
Gerhard, does this actually help everyone, or are there exceptions?
Never and always. That's just how things are. It's like this. The more conscious people are, the more they resolve their issues, perhaps even working energetically, the more they are truly present in this life, the better it works. So, when people have very significant issues that constantly cause stress, maybe they feel it, or maybe they don't even know it. A lot of people aren't even aware that certain issues are still working within them. Or systemic issues can also have a very powerful effect. In terms of impact, it's actually the same as an emotional story. The effect is exactly the same. Many people have what are sometimes called karmic patterns, things they have brought with them from times like the Inquisition or other eras. But these can also stem from accidents in this life or from earlier stories. So that's simply what it's called, a collection, a medley of karmic issues, karmic themes, karmic patterns.
You mentioned it earlier, a difficult birth.
The difficult birth, for example, yes, exactly. That also plays a significant role.
I experienced this myself. My daughter had to be delivered with a suction cup, a vacuum extraction.
And then quite soon there were problems.
Yes, they then have this little deformation on the head, days long. But
no shifting of the sutures?
To be honest, I haven't noticed anything yet.
You can feel it if something is wrong. You really can feel it. It was the same with my daughter. She was also delivered with a suction cup. She had the umbilical cord around her neck, so she was basically pulled back, and I was pulled back and forth until it finally worked out. It was very difficult. And that was interesting. She was incredibly sensitive on her head. She would always grasp with her right hand like this, not from the front to the back, but from the shoulder forward, not the other way around. And her spine was shaped like a lemon. So not twisted like in scoliosis, but simply curved like a bow. That definitely caught my attention, but back then I didn't know what to do. At that time, however, I addressed it using a kinesiological method. Back then, an Alfred Schatz, a brilliant teacher, told us about this. He shared this knowledge with us. He was familiar with chiropractors from the field of kinesiology. We tested how long you need to touch and which point you need to touch, and that's exactly what we did. Fortunately, the mother of the daughter was willing to participate as well because she could see that something was wrong. She was usually very sensitive to things like this, but she decided to join in. Then through testing, I identified a specific point, just touch it for 20 minutes. And the daughter screamed incredibly loudly. But usually her screams were twisted with pain, whereas this time she screamed with a kind of activity. That means she inflated her skull so much that the sutures slipped right back into their correct position. Today, I would use my method, the Schneider method, which certainly works as well, but back then this was the way I knew how to do it, and both approaches work. In any case, everything was fine afterwards. The lemon, so to speak, the bowing, the curvature was gone immediately. The sensitivity. Of course, you're careful for a few days anyway, but then that was gone too. And for about 2 or 3 days, she still didn't have any strength, which makes sense. She really hadn't been able to do anything properly. And then actually everything was back to normal. It was gone. Yes, that really was amazing.
How long does such a treatment take, approximately?
Now, I do the head treatment the way I do it today.
The
Schneider method.
That one right there?
Goes very quickly. So things like hardenings and similar issues, those resolve very quickly. Once you've really mastered it, then truly, even in the bone, also three-dimensionally, it actually brings the cells back into the correct position. And also the adhesions. Bruising always causes adhesions. When the adhesions are released, that actually happens very quickly. And when I say I do 3 or 5 treatments, then maybe I spend just a few minutes there, but I always include the whole body. Because, as I've often said, holistic truly means holistic. Everything is interconnected, everything is related to each other. So I simply always work through the body a bit as a basic principle. Often it only takes small techniques, or sometimes it requires a bit more. If there's another issue present, then that is addressed as well. That's why overall, when treating head injuries, the time involved is about half an hour, maybe sometimes an hour, but that's already quite a lot. So it really goes quickly. And with people who are dealing with major issues, whether consciously or unconsciously, many simply continue living emotionally dried out in a normal, matter-of-fact way, but the emotion is blocked somewhere inside. In such cases, it can also happen that nothing can be done at all, or that it takes a very long time. Or I remember I once had a boy from Tyrol or Salzburg, somewhere around there. He was about 12 or 14 years old. I released the tension in his head. It was as hard as stone. I freed it up, but as soon as I went around, it was closed again. He immediately closed up again. Later, I did some research and found out that the family had extremely systemic issues. Truly extreme. And the boy wanted to save the family and took all of that on himself. He basically carried the entire burden of the family. And he really held on to it with all his strength, but that just doesn't work. So I told them they should resolve it, that they should address it, but I don't think they did. And then there's nothing you can do. That's just how it is.
You know, especially with our topic, healing traumatic brain injuries, it's no small matter if that's not fully healed. And there really is nothing comparable to your method.
Well, at least I don't know of anything, no.
That's what you told me. And chronic headaches can remain, concentration problems, epileptic seizures, all of that.
Exactly. Some people become aggressive, others become lethargic.
Mood swings.
And when you think about what's going on inside the head, also the so-called homunculus, this part of the nerves that neurologically and physiologically supplies the body, if I have blockages anywhere, of course that also affects the entire body. Or if I have injuries or hardening at the front, that also impacts my planning, my life planning. At the front, I have the themes related to planning and moving forward. At the back, I have memory. Now, of course, this can also disrupt memory. Or at the back, there is also balance. Coordination is included there. And I remember I had a little boy who was tearing around like crazy. He was incredibly fit physically and so on. And then he started fooling around somehow on the deck chair at the swimming area, but they had put the chair on the concrete, on the asphalt. And then he fell off somewhere and hit the back of his head really hard. And after that, he couldn't really, well, he could still walk, but he really had to go very slowly and had to keep correcting himself. He was really all mixed up. Then his mother, who already knew me, came with him. Then we just quickly corrected everything, and after that, everything was fine. Or I often have people who experience dizziness, they fall down, hurt themselves, and then have vertigo. Or I experienced something really crazy once. I even made a video about it myself. I had a young woman, she was in her mid-20s at the time, this was some time ago, who told me, I get headaches whenever it gets a little warmer, a little colder, or when I have a bit of stress. She always had headaches as soon as there was even the slightest change. That was actually right around the beginning when I started doing this kind of work. And then I tested kinesiologically and it indicated an injury in the 3rd year of life. So I said, yes, of course. And she replied, I don't know in my 3rd year of life. Then, right in the middle of the treatment, we called her mother. The mother said when she was 3 years old, we went sledding up front in the back, and then we crashed into a tree. And it really slammed her head right into the tree. And then it was as if there was a kind of adhesive spot. It was like a contusion that hit there and it stuck at that spot. And then I basically bent and moved the crown of the head. It's actually quite mobile as long as the sutures and everything are as they should be. And then I noticed that in one spot it was sticking a bit. Somehow it felt a little different than usual. And then I thought it might go a bit further there. And suddenly there was a real bang, truly a bang. The head vibrated and it jolted us. And then that adhesive spot, that welded area came apart. And then the dura mater was free, normal, and then she got down and said, now I don't feel anything anymore. And she really didn't have anything anymore. Everything was resolved. It was only because the dura mater was basically stuck upwards. Because it was adhered, she had lost all mobility. That means every change caused her pain. That was an amazing experience. It was a bit spooky at first, I have to admit it startled me. But you just encounter things like that when you do somewhat extraordinary things.
We need success stories like these. And what I find so wonderful is that you share your wealth of knowledge. You provide training. Is everyone allowed to come to you? Are there any differences? Courses, and where can people find you? You now live in Cyprus, but you keep coming back.
Exactly. I have 2 websites. You can visit schneidermethod.com if you want to learn the technique. And then there is gerardschneider.at for those seeking professional help. Learning, a certain amount can be learned by anyone. So I have just recently tried working with people who have never done anything medical before because friends and clients kept saying, they asked me, could you do something for us as well? We would also like to get involved. We just want to do a little something for our family or friends and so on. And I'm incredibly amazed at how much now we've had 2 sessions of 3 days each, how much they have understood and are able to put into practice. I honestly would not have expected that, I must say. But otherwise, of course, for massage therapists, physiotherapists, osteopaths who are already working in this direction, they can develop incredible potential with this, especially in Germany, in this group of orthodontists. They said that this is a huge difference compared to osteopathy. They were truly amazed at what is possible here. Medical doctors can also learn it if they are interested in working manually. You really have to immerse yourself. You have to enjoy developing a sense for it. You need to have an inclination to want to work with your hands. Of course, not everyone wants that. But if you enjoy it, then you can learn it. And it happens relatively quickly. I am truly surprised.
Oh, wonderful. This is truly an absolute highlight worldwide. What is your vision for our future?
In which direction?
In any direction. For the best?
That's a rather broad question. In terms of health? In terms of health, yes. You have to be honest about that too. So much would be possible for our health if it weren't forbidden or somehow sabotaged. If medicine and what people want to achieve for others were truly free, then we would have almost no sick people anymore. We would have such a different life. We know that some are making billions while the others are basically not allowed to do anything. But yes, there is so much potential. I believe that it will happen. You can see it now. Change is happening everywhere. Everyone says there are so many doctors who want to leave the system, who are no longer satisfied. Patients are noticing that things can't go on like this. Everywhere, new methods and new products are emerging. So the transformation is already underway anyway. We are already at the beginning of a new era. I believe this can no longer be stopped.
And you are the best example of that.
One of them,
Gerard. Gerhard Schneider, a healer of the new era. I am so glad that you are with us. And I always try to imagine, since I haven't yet seen you work, how you do it. First, you diagnose with your eyes closed, and then you apply these subtle impulses. Subtle, yet so intense and powerful that even crooked bones can realign or straighten themselves. But
that's where it's not subtle. So it ranges from very gentle to very intense. Everything is possible. It is holistic, the entire spectrum in every direction. And with only the very gentle, you can't achieve everything. And with only the very forceful, you can't either. You need it all. And sometimes it truly is so subtle. Sometimes you are really just organizing cells, and sometimes it is very intensive work. Is
that exhausting for you, Gerhard?
Yes, it is exhausting in the sense that you have to be very present. You don't work on people, but with people. So I have to be fully present. I have to connect with the whole situation. It's not always exhausting, but very often it is. And above all, the people who come to me usually have bigger issues where something truly needs to be addressed. And my credo is not to treat, but to resolve. I have so many people who say, I've already had so many treatments and almost nothing happened. And then we do 1 or 2 sessions, and then the whole issue is resolved. So we need to move towards not examining endlessly and doing a lot, but rather doing what actually helps.
Thank you, dear Gerhard.
Thank you very much.
I always wish you all the very best. I'm glad that you are with us and that we are recording several conversations about your Schneidermethod.de or osteomodulation.
Modulation and osteomodulation, yes?
Modulation and osteomodulation. Wishing you all the best.
Thank you very much.
And to you, my dear viewers, we always wish the very best. Above all, the very best of health. Yours sincerely, Britta Berthold.